Today we'll discuss about low blood sugar level, also known as hypoglycemia. Let's start by understanding what hypoglycemia is. Glucose is the main fuel for our body and brain, and when the level of glucose is reduced in the body, it leads to some important health complication that is known as hypoglycemia. According to American Diabetes Association, blood sugar level less than 70 mg per deciliter is termed as hypoglycemia. But in certain special situations or individuals, it might have to be treated at a level different than 70 mg per deciliter. The most common reason for a diabetic individual to experience hypoglycemia is irregularity or inconsistency in diet, exercise, or medicines. This can be very well understood by a common example wherein a diabetic individual visits a mall or a market. Suppose on that particular day their meal gets delayed or are missed and physical activity is more as compared to other days. So this situation can lead to hypoglycemia because on that day the medicines taken in the morning are already working, but the calorie intake is reduced and the patient is burning more calories as compared to other days. Apart from this, any acute illness and alcohol consumption also causes hypoglycemia. For the timely intervention and correction of hypoglycemia, it is very important for you to understand the symptoms of hypoglycemia, which include sudden excess sweating, trembling of hands and body, weakness, headache, hunger sensation, blurred vision, slurred speech, increased heartbeat, mental confusion, sinking feeling, or dizziness. Any of these symptoms, if felt, irrespective of the intensity, immediately check your blood sugar level. If the blood sugar level is low, then treat it with 3 teaspoons of glucose or sugar or honey. It can be taken as it is or after dissolving in water. Then recheck your blood sugar level after 15 minutes. This process of treating hypoglycemia is known as rule of 15, wherein 15 grams of fast-acting carbohydrate is consumed after every 15 minutes till the time desired blood sugar level is achieved. In case, if you experience symptoms of hypoglycemia but glucometer is not available, or suppose you are not at home, then immediately treat it. Also, if you repeatedly record low blood sugar levels in your glucometer without any symptoms of hypoglycemia, then you should immediately consult your diabetes healthcare team. Important tips to prevent incidences of hypoglycemia. Like it is important for proper sugar management, it is equally important to maintain quality, quantity and timing of meals to prevent hypoglycemia. Be cautious for the timing and the duration of physical activity, as too long or too intense physical activity without adequate calorie consumption can lead to hypoglycemia. Do take your medicines at the right time as prescribed by a healthcare provider. Also, make proper sugar records and discuss with your diabetes care team at regular intervals. Do not forget to discuss your specific sugar targets with your healthcare team. Check sugar levels more frequently on the day you experience hypoglycemia. Do not panic if you experience hypoglycemia. Make sure that all the family members have complete knowledge about the symptoms and treatment of hypoglycemia. Always remember, prevention is better than cure.